Hi again, everybody. Gentleman I always like talking to. I haven't talked to him in a couple of months, Mr. Bill Cassidy, senator from down in South Louisiana. Senator Cassidy, Lanny James, how you doing today?
Lanny James, I am fantastic, man. How are you, buddy?
Great. Good to have you on. Well, look, I see you pop up on the tube nationally every now and then. I know you've been heavily involved in a lot of things. One thing that Trump has been pushing for, and I noticed that you've been involved in also, is this opioid crisis. You know, until a year or so ago, I had never heard that terminology. I guess it's these painkillers. How bad is it in the state of Louisiana? I know you've instituted or tried to introduce some bills to institute harsher prison sentences for traffickers and curb the overprescription of opioids and increase funding authorization levels for the Comprehensive Addiction and Recovery Act. But let me ask you this about opioids. What in your mind is the basis of the problem? Are they prescribed too often, maybe in instances where something else would do almost as good?
Well, there's two issues. You got the legally prescribed opioids, and you have the illegal opioids. The legally prescribed occur in two situations. One, there's a very small number of doctors who, they're pill mills. You go, you pay $500 for a 5-minute visit, and you walk out with 5 different prescriptions that the person, the patient, so to speak, then goes around and tries to fill at different pharmacies and sells the pills. That's one group. The other group are well-meaning physicians who just give too many medicines out of habit almost. There are studies that show that the same type of patient, say with a sprained ankle, will go to the same emergency room, see 2 different doctors. One doctor prescribes enough for 3 days, and the other one gives enough for 30 days. The patient goes home. If they have a genetic predisposition to addiction and they take a 30-day supply, they will end up as an addict. We don't want them to, but that's what happens. And so that's a different situation of legal drugs. On the illegal, as doctors have decreased the amount of medicine that they're prescribing, illegal drugs are coming in to fill the void. And so an addict who can't get a regular pill now may be shooting up fentanyl or heroin.
Well, let me ask you this. When you talk about an addiction and you talk about 30 days, I guess that would hook about anybody. But does this happen with somebody who's taken them for 5 days or a week? Can they be hooked also?
Yes, there are some folks who are genetically predisposed, and even a little bit of exposure can addict them. Ideally, if somebody has pain, they try everything before they have the need for opioids. So, for example, my daughter had some dental work recently. The doc gave her some opioids, said if you need them, take them. So I said, dear, let's first take extra strength Tylenol 4 times a day, and then let's take Motrin, and you want to take that 4 times a day, but take it at different times, and don't let the pain come on. Go ahead and take the medicine before you have the pain. Do all that and see if you don't need the opioid. And turns out she never needed anything more than the Tylenol and the Motrin. So if you can take something else, better to take something else.
Is there any danger of having a reaction between two pills like that?
No. Tylenol and so-called non-steroidal drugs like naproxen or Motrin or ibuprofen, they work differently. So they just work in different mechanisms. Their side effects don't cross over. I've done that in the past when I've had some neck problems. That's kind of the way I think you should go.
Dr. Bill Cassidy, let me ask you this. With the opioid crisis, I guess every state has it. How bad is it in Louisiana? I know there's some states in the Northeast, I guess, where it's really, really bad. I don't know if it's New Hampshire or somewhere like that. Well, where do we stack up in that whole thing?
We're not as bad as New Hampshire and Ohio, but we're among the worst. if you just look at the amount of medicine being prescribed per population, way more than you can imagine people would need. It varies from parish to parish, and I just saw some data today, see if I can pull it up as we speak, about some of the parishes that are most affected, and some of those parishes are in northeast Louisiana, and so there are individual parishes that are far worse off than the state as a whole. The Washington parish, which is kind of south central, was bad. I'm looking at my notes here. But some of the parishes in Evangeline, Washington, St. Helena, St. Tammany, they're among the worst. But again, I didn't get them all down. And so it depends on your parish, but some parishes are worse.
Senator Cassidy, let me ask you this. I know there are all kinds of medical publications. I'm sure a lot of them probably come out every month. Why aren't these doctors responding? Surely there's got to be some information that they're getting on a monthly basis about how dangerous this situation is. How do you reach these doctors? How do you get them to stop doing this?
Let me give hats off to the Louisiana Dental Association and the Louisiana Medical Society. They have been very proactive in asking dentists and physicians, podiatrists, doctors of osteopathy, not to overprescribe, giving guidelines that you shouldn't give more than a 7-day supply for someone who's in for their first prescription, and doing mandatory continuing education that you've got to complete these 3 hours of training as to the problem with opioids. If you wish to get your controlled substance renewed, the Board of Pharmacy is also helping. So in our state, we're being very proactive about it. Also sharing information with law enforcement if it appears like a physician, a dentist, or a pharmacy is either overprescribing or overfilling.
You know, I know you were involved when they were trying to do this repeal of Obamacare, and that was what a lot of Republicans ran on. Senator Cassidy, I always felt like Obamacare, in my estimation, wasn't really to help people. It was about power and control. That's kind of the way I saw it. I don't know if you agree with that, but let me ask you this. Why wasn't it repealed? Do you think it should have been repealed? And I know you're working on some things. It looks to me like people like you, doctors around the country, some people that really know what they're doing could come up with a program to make it the best health care system we've ever had. And I know you're working on some things like price transparency in health care, which has been shown to help reduce health care costs. Where do we go with this? Which direction?
Well, one, we did make significant progress repealing Obamacare. We got rid of the individual mandate. The American people hated the fact the federal government said if you don't buy insurance, we're going to penalize you even if you can't afford the insurance. So we got rid of that, which is one of the major things that people did not and do not like about Obamacare.
Right.
And so we made some good progress. We got more to do. For example, there's just some people that are paying $50,000 a year for their Obamacare health care coverage. They can't afford it. If they don't buy it, they're penalized by the federal government. That's not fair. Again, that's part of repealing the individual mandate. Medicaid is a program that I just think states are having a hard time supporting. It's become so expensive for both the state and federal taxpayer. So I think we need to go somewhere giving states and the federal taxpayer relief from that, but also making sure that patients have access to coverage. We're trying to lower health care costs, Lanny. So we're doing, you mentioned price transparency. Most people have had the experience of getting a blood test or an x-ray and it costing an unbelievable amount. They
Right.
get the bill 6 weeks later, they can't believe how much it costs. We're trying to make it like buying an airplane ticket. You log on, you decide where you want to go, date and time, you see if you like the price. If you don't like the price, you go on a different date, different time, maybe even a different airport. And you get the price that you can afford. That's not the way it is right now. Your doctor orders a CT scan of your child's belly, and you don't know what it costs. If you got a $6,000 deductible, it might be $6,000. We're trying to get it to where you would know that price before you go in for the X-ray, you don't find out later.
I hate to say it, Senator Cassidy, we're out of time. Great information as always. Thanks so much for being on our show.
Thank you, Lonnie.
Thank you.